We're here at the Center for Sports Medicine and Orthopedics. We're here with physician Tim Ballard. Is that the right?
Sure. Yeah.
Okay. Tim Ballard, Dr. Ballard, and I know Tim personally as a great friend, also the person who replaced my knees some 12 years ago. Well, this is the illustration in the doctor's office, and to what would be, I guess, on the left side a normal knee, on the right side a OA knee.
John, everything went super good. We got a couple of good knees in there. You tolerated the surgery nicely. You didn't lose very much blood. I think you're going to do great these first couple days. Pretty decent pain medication for about 24 to 48 hours to keep you comfortable. We'll probably need a walker here for a week or two and then a cane for a few weeks, but so far you're doing beautifully.
And what was the condition? Do you see the condition of my old knees when you go in and do the replacement? Like,
absolutely. You saw how contracted you were getting, where you couldn't get your knees out straight.
Right.
It's because they were worn so bad. You'd worn the cartilage away on the end of your thigh bone and on top of your shin bone on the back of your kneecap, or your femur, tibia, and patella.
Okay.
And that's part of the reason you were so contracted. And then I put new surfaces on all the bones, and now they move great. They're nice and straight. They're not crooked anymore, and they come out
cool.
straight and
that is so cool.
Bend all the way up.
So I never could bend my leg up. I go to the steam room to do stretches, and I could barely get my knee to even go to the 90-degree mark.
No, you're going to now. And what's more important is whether they were about 20 degrees short of coming out into full extension. Now they'll come out fully extended.
Oh man, that is exciting. I'm not even sure, but took away the pain, and the choice was either an epidural or drugs. But the drugs have some side effects, so the epidural was kind of recommended. And what a blessing to have a physician who prays with you. And we both call upon the name of Jesus, the great physician, and it's been a great source of comfort and peace to me. So now that we're got the staples out, some x-rays, we'll see the prognosis.
Good. How are you feeling, John?
Tim, I'm feeling great. I really am.
Let's have a look at you here.
There's always some discomfort, but
your wounds look terrific. You're nice and straight. You don't have much swelling. Tell you the things I'm looking for is I want to see that your wound looks well approximated and looks like your wounds are healing terrific. You don't have much swelling. There's no redness. Your motion is wonderful. You're good and straight there. How much flexion did they say you got?
Close to 90.
We're getting there, brother, and a lot of people feel like that when you take the staples out that loosens you right up. So you're going to feel a whole lot better now.
Oh, good.
Your x-rays looking together.
Oh, wow. And I remember you mentioned something to me when you saw me. You mentioned that my bones were actually out of line, and one of the things you had to do was align the bones up in order to get the parts to work right. Is that correct?
That's exactly right. Here's your preoperative x-ray. See where the end of your thigh bone and the top of your shin bone, you're rubbing bone on bone real bad on both sides.
Mm-hmm.
Now you've got new surfaces on the ends of the bones so they're not rubbing together anymore.
That is amazing.
John, this is exactly what I want you to look like 2 weeks after surgery. Now is a critical time for you to keep working hard in your therapy.
He used to give me shots of cortisone for the pain, and he said, "Hey John, when you're tired of the pain, let me know and we'll replace them," which he did, and I couldn't be happier. That's been some 11 years ago.
Where's the time go? You're an awesome guy, and if anybody ever used them, you sure have.
Yeah, I did. Just yesterday, I ran a 5K in Chatsworth, Georgia, called the Teardrop. They had a 5K, 10K, half marathon. 5 about all I can do. But Tim, you've experienced, of course, look at all these plaques. They represent a whole lot of education. Maybe you could tell us a little bit about your background, how you got into the orthopedic surgery, and just give us a little background, and then your experiences with people, and what your opinion on quality of life and maintaining a certain level of health and fitness.
Sure. Just from an educational standpoint, I went to med school in Cincinnati, did my residency in Iowa in orthopedics, and then I decided that I wanted to specialize in adult hip and knee reconstruction. And so I did a fellowship year just of specialization, mostly in hip and knee replacements, but other forms of reconstruction. And I almost went someplace else, but I got a call from who turned out to be my senior partner to come down to Chattanooga and look at the practice. And they said they needed a total joint surgeon. I guess they did, because I've been super busy, and I prayed that I would have a busy practice, and thankful that that's what's happened. So.
Yeah, I know you're a busy person. How many years have you been practicing?
26 years, and I've done a little over 30,000 joint replacements.
How many? Say that.
A little over 30,000 joint
30,000. That's
I
pretty.
remember when I was in training, this guy I knew got an award for doing a lifetime achievement award for doing 6,000 joint replacements, and I thought, isn't that amazing? Who would ever do 6,000? But here we are, and I want to make sure you know that I'm humbly grateful for that. I'm surprised at that number, and just grateful.
That's amazing. And I've never been happier with, I recommend to everybody, if they're getting bone on bone and knee problems, come and see you, because it's been a blessing to me. And like I even asked you, can I run on these? And you said, hey, do what you want. We can. And I just did a run yesterday. So, well, how about you obviously you stay in shape. And what are the things you do to maintain a level of fitness?
Well, and your body will put up with a lot in your 20s and 30s. You get to be in your 40s, 50s, and 60s, and as you know, if you don't eat right and exercise, that doesn't tend to go well. So, fortunately, I married a nurse, and so Nurse Ballard makes sure that I am fed well, that she feeds me healthy, but then I also keep moving. You know, I try to do cardio and weightlifting resistance exercises. Of course, those resistance exercises have changed with time. I'm never going to bench press 300 pounds again, you know. So I recommend to my folks that as much as I want to be standing beside the operating table instead of laying on it, I try to do weights that I can do 12, 15, maybe even 20 times. And then cardio, I try to maintain non-impact stuff. So I'm not a sprinter anymore, but we'll do elliptical, slow-paced jogging, exercise bike, swimming. And I think part of the trick there is to change things up. You avoid overuse injuries if you do kind of a circuit training thing and try to do different things. But it's important, you know, to avoid excessive alcohol. And I don't drink at all, but excessive alcohol, you know, obviously smoking, and to stay active and stay at a healthy weight.
Yeah, I guess that cross training has kind of been the new, came in. I'd never heard of it before, but that's kind of what I've done all my life, just different things, you know. Of course, with triathlons, you do 3 things.
Yeah, you may have been one of the people that ushered that in, but overuse injuries tend to be from doing the same thing over and over for too long, and you can help avoid some of that by just changing things up.
Yeah, and you've seen, 30,000 joint replacements. Have you noticed that there's a difference in terms of the recovery and the ability to go through the operation when a person is pretty well in shape as opposed to...
Oh, sure.
So it's a big difference.
That makes a big difference. I mean, obviously the shape that you're in ahead of time helps a lot, and plus your enthusiasm and motivation for what you want to do afterwards.
Yeah.
I mean, if I do the operation and you're not going to do the therapy afterwards, I'd rather you tell me you're not going to, and I won't do the operation. So.
Yeah.
But then I've also seen that our techniques and perioperative management have all changed an awful lot since I've been here. So when I was in residency, people stayed in the hospital for 7 or 8 days after a joint replacement. And then when I got here, I was excited when my length of stay got under 3 days. Now I'm doing a lot of folks that go home within a few hours. So almost half of my people now I take to our surgery center, and they go home within a couple hours. And part of that's too, my anesthesia colleagues have different blocks and long-lasting anesthetic techniques that help get you through that first 36 hours, so that by the time you go home a few hours after surgery, you're up and down the hall and getting in and out of bed and on and off the toilet and able to go up and down a few stairs. And then when I let you go home, I want you to get up and walk every hour, so you're really using that thing.
Yeah. I'm watching the video on the couch, and they just are having a hard time figuring out what to do.
Sure. Well, there are different reasons that people come in for a joint replacement, but the main thing, of course, is pain or lack of function. And when somebody comes in with a bad arthritic joint, of course, I want to see what we can do non-operatively. I may offer, like I did with you, I did injections with you for years, anti-inflammatory medications. For certain people, some exercises may help, or bracing. But if you're bone on bone and those other things aren't working and you're hurting bad enough that you want something done, then we can put in a new hip or a new knee.
Yeah. Yeah.
And mostly a knee replacement now means I'm putting new surfaces on the ends of the bones. You're not taking the whole knee out. So your knee's made up of the end of your thigh bone, the top of your shin bone, and of course your kneecap out front. And we put new surfaces on those three bones so they're not rubbing together anymore. And then in a hip, your hip's a simpler construct of a ball and socket. I put a new socket surface in your pelvis and put a new ball on the end of your femur.
Yeah. It's amazing. Of course, you've seen it personally with the advances that have been made in the quality of the products that are used in the replacements.
Sure, like if you look at knee replacements, the previous generation, they looked at the Mayo Clinic at 9,200 joints of a particular type that I did for a long time. In fact, the kind that you've got in. And 94% of those were doing well 18 years after the surgery. However,
Wow.
the newer ones we're doing now, we expect to be a 30-year knee. Similarly, the
Gosh.
previous generation of hip replacements, 95% of those were still doing well at 20-year follow-up. The ones we
Wow.
do now, we hope again is going to be a 30-year hip. And part of that is the newer wear surfaces that we use, the polyethylene or the plastic shock absorber, is highly cross-linked on a molecular level. And what that means is it gives you 91 to 93% less wear in the hip and about 89% less wear in the knee. So just roughly 90% less wear.
That's amazing.
Yeah.
Amazing.
And then the other thing that's important about not just increasing your daily activities and improving your quality of life is it improves your overall health. If you've got, as you're the best example I know, you get hips and knees in there, you can actually get up and get going and do the things that you want to do. It's great for your health overall.
Yeah.
I always say, and I think I've shared with you, that old people are like sharks. They stop moving and they die. You've got to keep moving.
Of course, you're saying like the physical therapy is the key to this, isn't it?
Yeah, John, I think that's the big thing is that to get a good result, you've got to have good physical therapy afterwards. And for somebody like yourself who had such significant deformity and flexion contracture preoperatively, it takes all the much more work to get your soft tissue stretched out afterwards. But I think you're making great gains. We got to get about another 10 degrees of extension for you, and I'd like to see you get another 20 degrees or so of flexion. But so far, so good. Just keep up the good work.
All right. Thank you so much. Well, Tim, the other thing we like to talk to people about, besides for enhancing their quality of life through fitness, is just what drives you. What's important to you? Is there spiritual beliefs that help guide you through this? I don't know. I guess it's a bit of a trauma to go through life in some respects.
Well, and I'm glad you asked that, because the most important thing about me is not that I'm an orthopedic surgeon, it's that I'm a Christian and Jesus Christ is my personal Savior.
Yes.
Second to that, I would say, is that I'm a husband, and then next to that is being a father and a grandfather. And it's important to keep those priorities straight, because whatever you're doing in life, you can do it to serve the Lord. You know, the Bible tells us to do all things as unto the Lord. And my particular ministry happens to be orthopedic surgery, but basically anything you're doing in life, you can do as unto the Lord and make it a ministry. And I hope that
that's
I've been
great.
His tool through this. That's been my intention.
That's so great. And how many children?
I have 5 of them. I think there's 5 out there right now. And then there's 5.5 grandchildren. There's 1 other cooking.
Oh.
And
love
talking
it.
about perspectives, my first grandson was named after me. So my son came out to the house. He said, "Dad, we found out we're having a baby boy. Can we come over to the house?" Absolutely, you can. So he came over. He said, "We've been thinking about names. And you know, John, my name is William Timothy."
Oh, okay.
And so I thought, boy, I hope there's a William or a Timothy in there someplace. And he said, "Dad, it's going to be William Timothy II." And I cried, ugly cry, for about 30 minutes in front of my wife.
I
But
love it.
talking about lifetime perspectives,
Yeah.
you mentioned all these plaques and diplomas and those publications and presentations and all that kind of
Right.
stuff. None of that means anything when you got a grandson named after you. It's like Yahtzee, you know.
That's
that was
great.
it.
That's great. That's great. I even noticed your picture with President Bush up there. It's,
Yeah, and you know,
Well-
you may not realize is in that picture is my son Cole is actually in Erica's belly at that moment. So
I'll be darned. There's that's pretty amazing. That's
Yeah.
pretty amazing. Well, Tim, that's such a blessing, and we hope that people that watch these videos will not only be encouraged and motivated to do something, like you say, you got to keep moving as you age, for their quality of life, but more importantly for their spiritual life, and the fact that Jesus Christ is the way, the truth, and the life, and no one comes to the Father but through Him. There is no plan B.
there is no plan B. You know, I tell my boys all the time, the most important decision you're going to make in this life is not what you're going to do for a living. It's not even who you're going to spend your life with. It's where you're going to spend eternity.
Yeah, that's a great
Choose
way to
wisely.
put it. Great way to put it. Well, Tim, what a blessing, and thank you so much for taking the time to give your interview and encouragement to all those out there that'll watch this.
John, it's been an honor and a privilege to be your friend and to watch this ministry blossom, and thank you for allowing me to be part of it.
Oh, thank you. Blessings.